Which of the following additional findings would you expect to find in a neonate with this condition? Neonate born with a 2.5 centimeter defect in the abdominal wall to the right of the umbilical cord, exposed, uncovered intestines. Infant has no other anomalies. Which of the following additional findings would you expect? Okay, so abdominal wall, not through the umbilicus. And so this is, I forgot how to say the word X something, but it's basically like the gut herniating through a defect, so like through the actual abdominal wall and not through the belly, so it's not covered in peritoneum. All right.
Okay.
I know it starts with the E. I just don't know how to say the word or even like spell it. Infant has no anomalies. Which additional finding? This is as a result of oligo. It's part of Potter's. Potter's is polyhydramnios. Basic knows increase alpha fetoprotein. Oligohydramnios. Okay, so oligohydramnios or polygohydramnios. So either too much amniotic fluid or low amniotic fluid. Too much fluid. Too much fluid would cause them to have more lung issues, I think. Potter oligohydramnios would cause less amniotic fluid, would compress them. And squeeze, but would it cause the herniation there? I don't know what the alpha fetal protein levels have to do with the development.
Okay.
So I'm not quite sure there. Dang, this is more a content issue. I'm just stuck on how all these things are relating. I want to say polyhydramnios.
Okay.
But I don't
Final
think
answer.
yeah, let's go with that. I just don't know that's correct.
Okay, so let's talk about this. This is something called gastroschisis.
Gastroschisis. Oh,
Gastroschisis is exactly what you described, where the intestine is exposed outside the body without a peritoneal covering. The one with the peritoneal covering, that's called omphalocele. Okay, so gastroschisis is associated with increased level AFPs. Okay, that's something that they like to test. Okay, polygohydramnios just means that there's just a lot of fluid, right? And usually those are going to be like esophageal atresias or duodenal because the kid can't swallow and kind of get rid of the amniotic fluid, so it builds up. And then oligohydramnios, right, is usually kind of renal agenesis or issues with the kidneys. So remember, the kid kind of, in a sense, when they urinate, they create some of the amniotic fluid. So if you can't do that, then there's going to be less of it. So decreased levels of AFPs, such as Down syndrome, increased maternal age, such as Down syndrome, but not really for gastroschisis. I want to say decreased AFP levels are associated with when it says not only Down syndrome, but also omphaloceles. I think omphaloceles, if I'm not mistaken, let's see, omphalocele risk factors.
Dang, this is not in first aid at all. Okay, let me write this down.
Smoking, pre-use certain medications. Oh, okay. So, see risk factor for.
Oh, I was thinking bladder exstrophy, but that's
Yeah, so that's going to be your bladder, right? So maternal age, alcohol, certain medications. Okay. All right.
Okay, increase alpha fetoprotein, AFP. What does AFP do? What is its
AFP
purpose?
levels, they're just kind of alpha fetoprotein levels. They're just a lab marker for certain diseases. When you get to kind of the repro section, they'll talk about how you can use the AFPs to screen for certain things. And, AFPs can be elevated in liver cancers. They can be, decrease in things like, genetic disorders. They can be increased in other genetic disorders, right? So it's a good question of, where it comes from. I can't exactly remember, but I know it's a lab test using the fetus to kind of think about certain disorders. So One of the things you're worried about here is they're saying that, you know, AFPs are also increasing gastroschisis. So